what we want to get from this meeting really is a synthesis in the early care and education sector of what are the, what has worked and what are the areas that there are challenges, so that we really have a roadmap for the next 3 years to take it to the next level, as I said in my earlier comments, and get to the spread and scale that is going to be, really challenging. And somebody said to me, well, why didn't we open this up to like a much broader group of folks? And we were very intentional about the people we invited to this conference because we really wanted to look at the leaders in the field and also think about the organizations that you represent. So Eva Daniels with the National Association of Family Child Care, FRAC, and all they do is CACFP. I'm looking at Lynette back there from Child Care Aware. The states that are here. The idea was to really try to develop an overall framework for the ECE sector, which then we would use as a roadmap going forward, given all the great things that are happening. I would be remiss if I didn't put that in a larger context. And there are similar meetings happening around the country, for example, in the school sector. Because we all know that if we're going to reverse the trend in childhood obesity in this country, it's not just one sector. It needs to be a multi-sector approach. So this is what we're trying to do for the early care and education sector. There's also the school sector, the clinical sector, and the community sector. And it needs to be an integrated approach. And there has been a group of folks that have been thinking about that as well. Bill has been kind of leading that effort to really think across sectors about an overall plan, so that we don't lose the momentum in terms of reversing the trend in obesity and overweight in this country. So that's how it fits into the broader picture. Let me do a couple of things before I make some closing comments. Nothing can be accomplished without collaboration and partnership. And I want to just again really thank the supporters of the summit. So Kellogg Foundation, the National Institute of Food and Agriculture, the David and Lucille Packard Foundation, the Robert Wood Johnson Foundation, Penn State Better Kid Care, the American Heart Association, Blue Cross Blue Shield of North Carolina Foundation, Kaplan Early Learning Company, and the Centers for Disease Control and Prevention, and Nemours. We were all really proud to support this summit and to bring you all together. And I think I can say unequivocally for the group that it was a great investment, and the time that we spent in both planning this, because it was a great effort led by Allison and the planning committee, but all of your time in spending with us has been really, really valuable. And this, as I said earlier, it's all about action. So we really want to use this information to move the field even further and really be change agents in making things happen in this sector.